Before you learn how to use passive movements as a treatment, remember the following things you need to do when working with people. Always wash your hands before working with someone. Use good communication to explain what you will be doing. Make sure to get consent to the activity and use modesty or draping as needed. Use your hands to touch in a way that is firm yet comforting. Think about holding an egg. You need to hold the egg firm enough so it doesn't fall out of your hand, but not so hard that it breaks. In the same way, this is how to hold a person's body so they feel protected and safe, but that you're not squeezing or pinching. Use your eyes to observe what you're doing and how the person is responding. Are you completing the whole movement? Is your position or something else blocking the movement? What does their facial expression indicate? Are they feeling comfortable, nervous? Do they look like they're in pain? If so, is it because of the stretch at the joint, or are you squeezing or pinching as you're moving? Use good body mechanics as you move. Remember to keep your back straight and keep the person's body as close to your body as possible. Finally, only use passive movements when the person cannot move on their own or they need to rest the joint. Teach the family how to do these. Once the family can do these safely and correctly, you can work on other things. Now you know some of the key points in using passive movements with people. We'll look at how to do different passive movements as treatments. This video is not intended to be medical advice and should not be used as a substitute for professional diagnosis or treatment. The content is for informational and educational purposes only and is specifically presented for review by individuals already trained by Therapy Clinics International. Always consult with a qualified healthcare provider regarding any medical conditions or healthcare concerns.